Use the separator placement plier for placing the separators. Separators should be placed for 7 to 10 days for proper separation to take place. Or gauze rods in the floor of the mouth. See that the cheek retractor does not hurt the gingiva. And then air dry. This should give you a frosty appearance. Do not press the pencil too much onto the teeth, as the edge surface go on it for some time so that it sets. Some manufacturers have come with color coding for the brackets when you are using short elastics. Mark the bracket height on the mesial or distal side of the teeth so that you don't hide the mark. Take little of the primer, apply it on the bracket base. See the position of the bracket. Look at the bracket from the center of the teeth. The central line of the bracket. You can see the flared holes at the entry of the wire. Fold it. To the teeth. Adapt it well to the teeth. Then the excess is cut off. Preform band with tube. These come in different sizes. Apply the cement on the is formed on the cast of the patient onto the teeth. And again give a few twists, engage the first premolar and then engage the second premolar. This is done before placing the wire in the arch and placing the bend back. A wire which engages all the brackets is chosen. Pass it through the same side and then to the opposite side. You can use a ligature gun, something which should never be forgotten in MBT technique. This is to prevent unnecessary movement. These should be used during retraction on a 1925 stainless steel wire, or when you are using coil springs to open the spaces. And then softened and placed on the lower arch. The bend is placed always gingivally. The bend is placed in the gingival direction. Passing over each of the anterior teeth up to the canine on the opposite side. This is to stabilize the teeth and promote en masse retraction. Then twist it. Cut the ends and push the tag into the mesial embrasure. Use a 1925 stainless steel archway for bringing out slight expansion, dentoalveolar expansion. Then pass it through the buccal tube hook and connect it to the canine hook. Close coil spring. This is a simple spring type Orthodontics gauge. You get dial types also. It measures the force of the elastics. Yellow gives low force, green gives higher force, and pink gives the highest force. From the buccal tube hook to the canine hook, or from the buccal tube hook to the archwire hook, from the buccal tube hook of the lower class 3 elastics in class 3 cases. This will help to extrude the teeth and close the open bite. Mark the ends, straighten the wire, and then measure it. Be careful that in a proclined teeth, this is the Revi gauge. This is a prototype which has been developed for easily finding the correct bracket position. And the horizontal extension helps to place the bracket on the center of the teeth.